Hello dear students, today I will be explaining two different disorders which are mania and depression and the drugs used to treat them. Depression is characterized by the intense feeling of sadness, hopelessness and despair, the inability to experience pleasure in the usual activities, and also changes in sleep patterns and appetite, and all loss of energy, and the most severe one, which is the suicidal thoughts. While mania is characterized by opposite symptoms, which are enthusiasm, rapid thought and speech patterns, extreme self-confidence, and impaired judgment. The first-line agents to treat depression, because of their fewer side effects and relative safety, is the selective serotonin reuptake inhibitors. An example of this group is fluoxetine, citalopram, escitalopram, fluvoxamine, paroxetine, and sertraline. All of these drugs, they selectively inhibit the serotonin reuptake, which will lead to increased serotonin level in the postsynaptic space. Most of the antidepressant drugs, they take at least 2 weeks to produce significant effect. That's why the patient should continue taking them. The next group to treat depression are the serotonin and norepinephrine reuptake inhibitors, or which are abbreviated as SNRIs. These drugs include venlafaxine, desvenlafaxine, and duloxetine. From their name, the mechanism of action is that they inhibit the reuptake of both serotonin and norepinephrine. There is also the atypical antidepressants group, which have different mechanism of actions. The first one is bupropion. This drug, it has weak dopamine and norepinephrine reuptake inhibitor. The second one is mirtazapine, which enhances the serotonin and norepinephrine neurotransmission via mechanisms that related to its ability to block presynaptic alpha-2 receptor. It can also block serotonin 2 receptors. The third one are the nebazodone and trazodone. These are weak inhibitors of serotonin reuptake. Also, they can block postsynaptic serotonin receptor, especially the 5-HT2A receptors. Another antidepressants group are the tricyclic antidepressants. This group, they inhibit both the norepinephrine and serotonin reuptake. An example of this group include imipramine, amitriptyline, chloripramine, doxepin, trimipramine, diazepam, nortriptyline, protriptyline, maprotyline, and amoxapine. These tricyclic antidepressant group, they can also block the serotonergic, alpha-adrenergic, histamine, and muscarinic receptors. And because they block these receptors, they are mainly responsible for the side effect of this group. The last group of the antidepressants that we will be discussing today are the monoamine oxidase inhibitors. This group, they inactivate the monoamine oxidase, and which is the enzyme that degrades the neurotransmitters serotonin and norepinephrine. And because they inhibit this enzyme, they permit neurotransmitters to accumulate within the presynaptic neuron, and this will cause the activation of norepinephrine and serotonin receptors. Drugs in this group are phenelzine, tranylcypromine, isocarboxazide, and selegiline. And they are considered to be the last line agents because of their risk for drug-drug and drug-food interactions. If we pass to the treatment of mania and bipolar disorders, the first line agent are lithium. And other drugs that are mainly used for seizure, which are the carbamazepine and valproic acid, and lamotrigine, and also antipsychotic drugs like risperidone and olanzapine. But all of these drugs are mood stabilizers. Thank you for watching. Please don't forget to subscribe to this channel.